Around the country look toward businesses reopening. There is concern about a possible second wave of coronavirus infections.
Yeah, plus face masks are a nightmare to find, but there may be a way to reuse them. We want to join Channel 2 health reporter Haley Hernandez right now for more on both of these subjects. Good morning, Haley.
Hey, good morning, guys. Yeah, so UTMB has done the research and they say, yes, single-use masks can be disinfected and reused. Out of caution, the CDC had been advising people to throw away surgical masks after they were used. But using an autoclave, a machine found in hospitals, UTMB is steam sterilizing the masks. And they say even after the third steam cleaning, masks are still effective against viruses. This should help healthcare workers keep life-saving equipment in stock. And we know large doses of vitamin D have been used as an experimental treatment for coronavirus. Now, Northwestern University reveals a study showing a strong correlation between severe vitamin D deficiency and death rates in COVID-19 patients. The research team says patients across several countries with severe deficiency are twice as likely to experience severe complications, including death. Now, could the U.S. see a resurgence of COVID-19 cases in the fall? Some experts, like Dr. Anthony Fauci with the White House Coronavirus Task Force, say yes, and here's why.
The United States leads the world with the number of COVID-19 cases, and we're all anxiously waiting for the number of cases to start to decline. But 2020 might have more in store.
If the numbers indeed start to go down as we go towards the end of May and June, then we're going to have to make a real assessment of what happens in the fall. Does this virus come back? Or if it comes back, is it the fall or this time next year?
Experts with the NIH say countries in the southern hemisphere approaching their winter seasons are starting to see cases of COVID-19 appear, suggesting the disease could be seasonal. Experts also say if there is a fall resurgence in the U.S., researchers are working to better test and identify COVID-19 as well as trace contacts, meaning the country could be better prepared.
Now, of course, you know there are currently a handful of vaccines in clinical trials. We have mentioned this on our broadcast. Some are even hoping to be available by September. Those have yet to be proven safe in humans. They are hoping to start human trials by the end of this summer. If they do not work, there are 80 others in the beginning stages of trials. So even if these that are ahead of the game are not ready by the fall, there are some coming right behind them. Hopefully one of the 80 to 100 vaccines out there will be the one that will help protect us. Amy?
All right.